Hi everyone, this is Niko Ana coming to you, and I am talking to you today about what is the SUD level, stands for SUD, subjective unit of distress or discomfort, and why do we use it in EFT tapping? When should we use it, and when should we maybe not use it? So that's a question that I get a lot. So I thought I would just go ahead and make this video and talk with you about it so you could have a better understanding of it. So you guys listen, it's not that hard. It sounds really fancy, but SUD stands for SUD, subjective unit of distress or discomfort. It's just a really simple term that was developed by psychiatrists in the 1950s to help measure psychological patients' levels of distress when they were working with them. So in EFT, it's used as a way to determine, first of all, what your overall general distress or discomfort level is around a particular feeling, issue, physical, mental, or emotional problem before you start tapping. And then you also use it as a way to determine if you've gotten any results after the tapping, if anything's gotten better. So it's a way to just test your progress. And sometimes it's really helpful, not just to test your progress, but to sort of remind you that you're making progress. Because sometimes we tend to really just kind of dismiss our progress after it's over, like, oh yeah, so what, I was at an anxiety level of 10, I tapped for 5 minutes and then I was down to a 5. I mean, that's a huge drop. But we tend to dismiss those things because of what we call negativity bias in our brain, which is our brain's tendency to always focus and remember negative things and to really just let positive experiences kind of slide by and not remember them as much. So that is why we use it. Now, here's the thing. People will ask me this a lot. Do I have to use it? No, you don't have to use it. It's not a rule, okay? EFT is not a discipline with steady, hard, fast rules. Now, there are definitely guidelines and there are definitely protocols and processes that have been developed over years by people who are experts in the field and who have shown time and time again through testing and through experience that certain processes do work. So with that being said, a lot of times whenever I work with clients one-on-one, if they're having trouble giving me a number because perhaps either they're worried they're going to get the wrong number, they're overthinking it, or they just don't think that way, it's hard for them to come up with a number, then that's when I would say, if that's a problem for you, if you're trying to get a number 0 to 10 about an issue before you tap on it, or even after, and you can't come up with a number, don't stress over it. Just switch to a different method. For instance, maybe instead of using a 0 to 10 scale, like 0 being I feel no distress and 10 being I'm at the max, maybe think of it as like, okay, mild, medium, or high. Mild, moderate, or maximum. And just come up with a way to test it for yourself that doesn't feel hard or doesn't feel, like you're going to stress yourself out more trying to figure out the number. So that's a deal with the SUD level, okay? And now, here's the other thing. If you just can't get a measure of any kind, whether it's a number or mild, medium, maximum, whatever it is, if you just can't get it, okay, just skip it, okay? Don't let it stop you from tapping, because you might find that after the tapping, you can just check in and say, well, I feel better. And that's fine too, okay? So with all that being said, okay, let's just do a little kind of practice demo on how to get your SUDS level, okay? So let's just say, and I'm just gonna tell you my method, you guys. This is how I do it when I'm working on myself. Let's just say I have some anxiety about something, and I'm gonna start with just the word this anxiety, because my body and my mind, my nervous system knows exactly what anxiety it is that I'm tuning into. So what I do is I stop and I just put my hand over my heart. This is just what I do. You don't have to do it like this. This is how I tune in. And I close my eyes and I just tune into that feeling of anxiety. And then I ask myself, this is how I do it. I ask myself to get a number 0 to 10. And then what happens is either I hear the number or I see the number in my mind's eye. And it usually just pops up really quick. And that's the thing, is you got to go with your instinct. Don't overthink it. So if you're just tuning in and you just hear a 7, just go with it because it's not a math test. It's not math. You're not going to get it wrong. So 7. So I would write it down if I were you because we tend to forget sometimes after we get to the end. So write it down. So write down what you're tapping on, this anxiety, at a 7. Okay, so you start there. Then you do your setup statement. So you would set up, even though I have this anxiety, that would be your setup statement. You would use whichever setup statements you wanted to use for this anxiety. And you would tap through however many rounds that you wanted to tap. It could be 1, 2, 3, or more. When you feel like you get to a point where you want to stop and check in again, take your SUD level again. And once again, just tune in after you stop tapping, take a deep breath, check in, and try to really feel into your body, okay? That's what I tell people is just kind of, what do you feel in your body? And the number should come to you, okay? Now, if you can't get an exact number, you might just say, well, it feels less. You can maybe just say it's less or it's more or it's about the same, and that's okay too. So you can start with the 7. You can say, well, I don't know what it is now, but it does feel a little less. Maybe it's a 6.5, and that's okay. So it's not a judgment. Just because you didn't get a big shift, like you didn't go from 7 to 0 in one round of tapping, doesn't mean it's not working, you guys. Many times, especially when you first start tapping on an issue, your number could go up. And this is why, okay? That could literally go up because all of a sudden this feeling you've been trying to push down and suppress in your system is being released and you're feeling it. You're not pushing it away anymore. It's coming through and all of a sudden you feel it and it seems stronger, okay? It's always been there. It's not that it all of a sudden, it's not being created by the tapping. The tapping is releasing the feeling. So it starts to come up and it could make your number go higher. You could be like, wow, I've gone from a 7 to a 9. Now, if this happens, there's 2 things you can do. You can either switch to a gentle technique like touch and breathe, where you stop tapping and talking and you just hold the points and breathe. So you would just hold, say, if you start at the eyebrow point, 1 deep breath per point. That's usually how I do it. I mean, you could do more. Okay, that would be touch and breathe. And there's a video about touch and breathe in this channel as well. Or what you would do is you would keep tapping. So you would tap another round and you could use the phrase remaining anxiety. So if you were using the phrase this anxiety and you tapped a couple rounds, all of a sudden you're like, wow, I feel it more, it's getting worse. Either switch to touch and breathe if you feel really overwhelmed and flooded. When I say flooded, I mean like you're crying or you're getting choked up or you're like kind of paralyzed. That would be flooded. If you feel flooded, switch to touch and breathe or just breathe. But if you feel like you can do another round, switch to the phrase remaining anxiety. So then you would go in and you tap remaining anxiety, and you would do a couple rounds of that. Check back in with your number and hopefully you've gotten a little movement down the scale, okay? Yeah, all right, so listen, you guys, there's another way to use the SUDS level. In clinical EFT, it's called validity of cognition. That sounds so fancy, but I like to just call it like measuring the level of truth, okay? So you can also test phrases when you're working with like limiting beliefs or anything at all that's emotional or mental. You can test a phrase and you can just test how true it is for you in that moment. So let's just say you're not sure if you feel angry or you're not sure if, let's use that. That's a good one. So if you were working with yourself and you were like, okay, I think I'm feeling angry. And then you would just make a phrase, I feel angry. And you'd say it out loud or you tune into the energy of it. I feel angry. Yeah. 0 to 10, on a scale of 0 to 10, that's like a 9 of truth. Like that 0 being, this isn't true at all for me, and 10 being, this is totally true for me. So when you test it, you may find that you get a different feeling around it. Like when you're using your thinking brain, you might think, I'm not sure if I'm angry, but as soon as you test it and you go into your body and your nervous system, you might feel it more and get a more accurate impression of it. So that's another way to use the SUDS level, okay? I hope that's really helpful for you guys, and I do hope that you learn to use it as a really great tool for helping you determine how much what you're tapping on is helping you with that specific issue. If you tap on something for a while and you just you can't get your level to come down at all, there's a couple reasons why. Either your setup statement might not be a good enough target. It might be too general, okay? Your setup statement might not be quite right. And this is a separate video you would want to watch about getting your setup statement right. Another reason is that you just are like really tired, you're really overwhelmed, and you really don't need to be tapping right now. You should probably be resting. You should probably, if you're sick, sometimes when you're sick, it's hard, it's hard to tap. Although I know a lot of people, and myself included, that do tap when they're sick. But if you're having trouble getting the SUDS level to go down, you just might want to, again, switch to some other self-care technique. Another reason that it might be happening is something called psychological reversal, which is a phenomenon that happens in human beings where we like resist letting go of something. We resist moving forward. So we're holding on to what it is that we need to let go of that's causing us pain. And it doesn't make sense. It's not logical. So that's another topic you want to look into. So those three, did I say three things? Yeah. So three things where your setup statement might not be targeted enough. You're just like really tired or sick, or maybe you should just try something else. You should just stop, give it a rest, let things process. Or you have psychological reversal, which there's something you can do for that as well. So I hope that this was helpful to you. I'm going to go now, but please do subscribe to our channel here. And we would love to see you pop in and make some comments. And thank you so much for joining. Namaste.